Wound cleaning. What you need is a tray or anything where you can put sterile gauze, a little bit of saline, a syringe to rinse it through, and then a red plastic bag where you can put in all your waste. You need gloves when you do this, and then the patient. The red bag must always be a little bit away from your wound. So if you are working on your left hand side, you will put your bag on your right hand side, so that there is one way movement from the one side, the clean side, to the dirty side. Don't put your red bag on this side, because then you must move over your sterile trolley to throw away the waste, and we don't want that. Okay, so now I've washed my hands already on the aseptic way, the way that you've learned today. Now I've put on my gloves. You will use, if you are really doing the wound, sterile gloves. Today I've just put on normal unsterile gloves. If it is a wound like this one, where it is a closed wound, then you will just clean it with your gauze. You take your gauze with your hand, put it inside the saline. You always use saline to clean a wound, and you start from the cleanest part of the wound. In this case, where it is a laceration like that, it is a closed wound, this is your cleanest part. So you start on top of the wound, and it is from the top to the bottom, and you only do it once. Go over the wound once, throw away your little piece of gauze. Then again, take the next one, wet it with your saline. We always use saline and not Savlon. The reason is that Savlon will destroy some of the skin if you leave it on the whole time. Now you go again on one side, throw it away, and then again from the top to the bottom on the other side, throw it away. So your wound is clean. Now the only thing that you need to do now is to close it. So if you want to put on some ointment, you put on the ointment, you put your gauze, and you fasten it with a piece of plaster. Okay. When it is an open wound like this one, then it is a different story. Now we don't want to go inside and use the gauze inside your wound. The reason is, when you are doing that, you destroy all the granulation tissue that forms inside the wound. You want the wound to close from inside out, and it's forming all these granulation tissue, and then the wound closes from there to the top. But when the wound is very, very dirty, that means that there must be pieces of sand in there or anything like that. Then you use the gauze to just wipe it away and then throw it away. Okay. What you do with a wound like this one is, you start also again from the cleanest part. Now the cleanest part in a wound like this will be the sides from the hand. So there you don't start on top of the wound. So what you will do is, you will take again your saline, and you will wipe from the top to the bottom in one way, throw it away. And again, wet it from the top to the bottom, throw it away. Now, to clean a wound like this, you don't wipe inside it. You take a syringe or a spray bottle if you have a spray bottle, and you just irrigate it like that. And again, until all the pus and things is out. Okay. You will see all the water will drain over it, and then you can put that one back there because you did not use it. Alright. Now you just dry it a little bit. From there to there, the rest of the hand. And then a wound an open wound like this one, you want the dressing to be a wet dressing to speed up the healing process. So what you will do is you will wet the gauze, what you put on there, or you will put on a saline dressing or a betadine dressing, or if you are in the government or in the private sector got a lot of nice ointments that you can put on. So you will just pack your wound with your wet gauze, and then after you've put your wet gauze, you put dry gauze on top of that one, and now you will secure it with a piece of plaster or you will secure it with a bandage. After you've done your wounds, you will throw away your syringe that you've used, because we only use it once. You will go back, you will throw away the saline, you will throw away your gloves, everything, and you will send your patient away. Thanks.